Henry Saldani here of Saldani Physical Therapy and Wellness. I'm so excited. This video is long overdue. What I want to talk about today is understanding your options and of course beyond your insurance. My biggest goal with this, as you have that unpleasant experience of navigating life with pain, is what I hear the most is, what does my insurance cover? And what I've really understood and seen was people unfortunately do not value medical care outside of the insurance. So this is, even with insurance, it's expensive. I get it. I've had plenty of medical care too. So if you're dealing with pain, it's only normal to have the first question is, what does my insurance cover? Because we know medical care is expensive. But what I'm here to tell you is that's not always the best question to ask. That's the only question you know how to ask. But this is information to expand your knowledge of what physical therapy or any other healthcare practitioner that deals with pain can offer you. So the traditional insurance-based system comes with a lot of hidden costs, a lot of limitations, and ultimately it prevents you from getting the comprehensive care that you need. And I'll give you some stories and some evidence along the way from my experience in the physical therapy field. So I've been doing this for over 8 years, and I'm going to go over this chart over here to really show, there's a lot of common pain relief professionals that can help you out, but the question is, what can they do for you, and does insurance cover it? So I want to kind of go through that. So going through physical therapy, of course, since I'm a physical therapist and my wife too, there's insurance-based physical therapy and then there's cash-based physical therapy. So this is using your insurance in-network. So I'll just very briefly go over it. We have deductibles, we have out-of-pocket maximums, we have co-pays, co-insurances. That's outside of the scope of this thing, but you have to know your benefits. And it's very confusing, extremely confusing, and very frustrating, even more than it is confusing. So I'll kind of give you the average cost per visit. This is super important. How much out of pocket you are responsible for, just to give you a little taste of your options out there. But mainly what I want to highlight is your options with insurance, without, and this is depending on after you pay your deductible and your out-of-pocket maximum. Has to be both. Each insurance plan will be different, and even tiers of those, whether it's the gold, the silver, the bronze, those might be different than within the same company. So it's super confusing, and a lot of them help you out and a lot of them limit you in different ways. Physical therapy, it varies widely. What I've seen is a lot of outpatient physical therapy, or even inpatient, they'll be contracted with certain businesses only. Blue Cross Blue Shield, Aetna, Cigna, big people like that. Medicare, TRICARE for the government insurances. So it just depends on what business contracts with who, if you're in network or out of network. So it varies widely. You might have a copay to put money towards your deductible, and plans might have an annual cap. That means they limit how much physical therapy that you can get, which can be a good thing or it can be a bad thing. But some companies might limit you to 20 per year. It might do 40, 60, or 80 per year, which sounds good on paper. The question is, how many hoops, loops, restrictions, what do they put you through? What do they consider? What is medically necessary to help pay for these services? And that can be due to different interpretation from different companies. So that's some of the part where I get a little bit frustrated, actually a lot frustrated with. So with insurance-based physical therapy, they got a lot of overhead. They got a huge building to keep cool, to rent out, or to keep warm if you're in the Midwest or East Coast. They have salaries to pay. Lots of overhead to cover, and that's to help take care of you guys. So the therapist, unfortunately, must see quite a few people at once to help counter those costs. So they have to delegate their services. They have less one-on-one time with you, the patient or the client, and then they have to delegate the rest of the time so they can make time for their other patients that they have. There are physical therapy assistants, there's athletic trainers, and there's physical therapy technicians, all with different roles to help you, the patient, out. I would argue, and this is me speaking as a previous manager, a lot of times in order to make any business wants to be profitable, you have to make these quotas, a minimum amount that you must do to either come out even or to make a little profit so you can pay for the business operations, bonuses, stuff like that, just to keep it going, advertisements. And with all of that busy stuff that they have to keep track of, patient outcomes might go down. I'm not going to say that for everybody, but if you have less time to give your patient, sometimes the quality goes down. I'll leave it at that. So with a cash-based physical therapist like me and my wife, you get a full session with us. We don't delegate anything. We answer the phone calls. We do the emails. We're behind the desk and the keyboard if you get an email from us. We answer your phone call if you call our business number. So it's not dictated by restrictions, authorizations, and all that stuff. You don't have to fight to get into us. So the cost is very transparent and very predictable. Whereas if you haven't met your deductible, it might not be predictable whatsoever. For example, I've had the most angry phone calls from people with Blue Cross Blue Shield. A lot of them didn't have a copay, even if they didn't meet their deductible or out of pocket or not. So that means that they're responsible for a portion or maybe all of what we bill the insurance for that specific session. So some of the times I get a call saying, or I got a call saying, hey, I got a bill for $300. Why is it that expensive? And I said, oh, yeah, we billed the insurance so and so much for the evaluation and the codes that we use, the care that we give you. And they're like, well, it's not worth $300. Why do I'm not paying this? And I'm like, well, we're a specialist. That's how much we charge the insurance. And then the insurance dictates how much of the cost that they cover, how much they charge you, the beneficiary, and then they dictate how much they pay us. So we'll just say if we charge $300, they're like, I'm going to pay $120. And then I might make you, the client or the patient, pay the rest or this much amount. And then they use that, they use algorithms based on whether you met your deductible and out of pocket or not. So it varies widely. We cannot give you a clear-cut answer. Only the insurance knows that. And it's not the same, even within the same company, you still have those different tiers like the gold, the silver, or the platinum and bronze, stuff like that. So even if you call your insurance and be like, how much am I responsible for? They might give you a ballpark and it might be different than the bill that you get at the end of the month or however often you get them. So cash-based physical therapist, you know exactly how much you're going to pay, and we have no restrictions. We don't have any hidden costs. It's super unethical to try and spring things on people for no reason. We're not really covered by insurance. You might get lucky, and if we do give you a super bill with all of our codes and what we do, you might get something back if you submit that to your insurance, but I would say don't even count on it. Anything you do receive, count it as a bonus. So you pay out of pocket, but you can also use an HSA, a high deductible spending account, or an FSA, a family spending account. The upfront costs might feel high, but if you put it into perspective, if you haven't even touched your deductible and you have a $8,000 or $10,000 or $15,000 deductible, they're going to charge you quite a bit, and it's most likely going to be more than what the cash physical therapists charge, anywhere from $150 to $300 per session. So it generally, if you don't usually meet your deductible, this is a better value just on paper. But what we actually give you, one-on-one care, no delegation. You actually talk to us on the phone. We can customize your program in between sessions. We can change things up. We can do all sorts of things. We could chat with your healthcare team. We have the time to call your orthopedic surgeon and get a protocol. We have time to talk to your personal trainer, get on the same page, and be like, hey, look, based on these symptoms, if you could not do this, this, and that, and continue to do this, this, and that, they'll be like, oh, that's awesome. Thank you so much for that. We're really going to take care of the patient now, or our client. So thank you so much for communicating. Nobody does that. There's no time in insurance-based systems to be calling someone's personal trainer. If it's a referring doctor, we usually communicate with them, but they don't get back to us for 48 to 72 hours minimum. So it's extremely frustrating for us and the patient because we want to get you better as quickly as possible. So it's a premium service. So upfront costs seem more, and it might be if you've met your deductible already. Then the insurance would usually cover more of that bill through the insurance. But since we don't go through the insurance, you have to pay the whole session out of pocket. But yeah, we give a premium service. Chiropractors. I'm not a chiropractor. I'm not any of the rest of these professions, but I'll just give you the very median or average amount. So a lot of them are cash-based. Some of them go through the insurance, and depending on what your benefits are, you might have to pay anywhere from $50 to $120. And that doesn't factor in how much time they spend with you because I'm not a chiro, I don't know. So some plans, they cover a limited number of visits. I've seen this on a lot of my plans that I've worked with. They'll specify how many visits covered by a licensed chiropractor. And then they'll also charge you a copay as well. So I've seen copays as high as $80, and they're like, what the heck? And it's a lot. So just expect to pay copays and possibly the rest of the amount of the bill if you haven't met that deductible. So, and this is me generalizing. Contact me if I severely misrepresent you. I would like to change that. I am not trying to bash on any other profession, period. I want to work with other professions to help you out. So with that, the focus is often short, frequent adjustments to address the symptoms. They really want to get after the root cause of this as well. What they don't have is long-term corrective exercises and strengthening. However, I have seen a lot of cash-based only chiropractors that primarily do this. And if that's you and we haven't chatted, please reach out. But most of the time, it's the short, frequent adjustments to help address the root cause. So that's just how their model is, so they could pay the bills and pay their staff, all that stuff. So same with them. We provide a holistic and comprehensive approach. Primarily, they adjust. They use manual therapies to help. They'll have a massage therapist maybe in their location to help you out after the adjustment. They might use different modalities. It just all depends on what their comfort level is. And they try and get after the root cause. That's no secret. That's obvious. But they also really want to get after the symptoms as well at that point. So a lot of people feel so much better when they get done with the chiropractic adjustment. So what physical therapists like to focus on is the long-term corrective exercises, strengthening, motor control, stuff like that. And you might not get that from a chiropractor. Pain management doctor. So these guys, they'll charge anywhere from $100 to more than $300 per session. They're classified as a specialist, just like physical therapists are, and you might have a copay with that. So that might be the cost of the visit, or that might just be the copay, depending on your insurance. So they're typically covered. Same with these osteopathic doctors. Those might be specialists. Those are your orthopedic guys. But they do have a higher copay, and if you've met your deductible, whatever your plan states, it might cover a certain amount. So they're similar to physical therapy, and with that, we do have a higher copay, and if you haven't met your deductible, you might be responsible for more of that fee for that specific visit. So the pain management docs, they primarily use injections and medications to provide temporary relief, but they usually don't fix the underlying mechanism or mechanical issues. So they really want to get after the root cause of the problem, but their approach is often temporary. The trick is a lot of these doctors partner with physical therapists and say, during this time of relief, do physical therapy. Now that you're more able to do that, whether it's walking, getting up and down from a chair, the toilet, in and out of bed, now you have less pain, so you can move your body more and then get after the root cause of the problem. But otherwise, just walking more or just drinking more water is not going to cure the problem. So physical therapy with the cash-based, we want to do more of a permanent solution, and we really want to focus on that movements and exercises and show you how to do that at home. We do not want to rely on medication or repeated injections. We want to get rid of those. Obviously, I don't have to explain that anymore, but physical therapists do not prescribe, nor do we change any dosage of medications. So if you're starting to feel better and you're working with me and you say, oh, my doctor says I have to take gabapentin or Tylenol or Tizan, whatever prescription, we cannot say stop taking that or take more of it. You have to ask your doctor to modify or adjust any of your medications. So just food for thought. We're just here to get you better and get you off of the meds and injections. So chiropractors, I just want to clump these guys together with the osteopathic doctors. They have similar session fees. Otherwise, they're very, very different practitioners. Chiropractors and osteopathic doctors, they use some good manual techniques to get after the pain. The DOs or osteopathic doctors are medical doctors, but with extra orthopedic training. So they can do manipulations, they can do different stuff as well. So they could be $100 to $200+ per session, limited coverage for the chiropractor, but the DOs usually they're kind of like the same as primary care physicians. Some of them might be specialists, like a orthopedic doctor. Then you're subjected to the specialist copay fee schedule, which is a little bit more. So they want to get after the root cause. Some of them might give you exercises to do, some of them won't. But if you do want to do that long-term strengthening and flexibility and getting people more fit and ready for life, I would like to talk with you. I want to collaborate and see how we can help each other. So call me. So same with that, we use a combination of manual therapy, hands-on treatment. We also have a structured progressive overloading program. So we want to make sure that you're not stuck doing the same exercises for 10 weeks. No. We want to assess your goals, see what you value the most, what's most important to you, and then we get you there. Whether it's golfing, getting back to walking, not falling, getting back to work without pain afterwards, without having headaches, doing your desk work for 8 hours a day. We want that to be as close to 0 out of 10 pain as possible for the rest of your life. And we want to give you the tools on how to do that. So $70 to $150 per session. That could be for a 60-minute only, more expensive for a 90-minute. That makes sense. So these guys are generally not covered by insurance. This I don't know too much about, but if you do have a prescription for massage therapy, I don't know what the process is to get that covered by insurance, and I don't know if you're subject to co-pays or anything like that. So ask your insurance in your specific case. They provide excellent temporary relief from muscle tension and stress. This does not address underlying weakness or motor control issues, if that's the root cause of the pain. They're really good at mobilizing the tissues, getting circulation, stretching, but they are not qualified to assess, evaluate, and treat musculoskeletal stuff in terms of like joint mobility, motor control issues, weaknesses, stuff like that. They'll give you stretches to do at home, hopefully, that match what your body needs, but they shouldn't be giving you exercise programs. So we use a larger strategic plan to build strength and endurance. We want to work with all of these providers. If you have a great massage therapist you work with, I want to know them. I want to see why they're good, and I want to be in their network. And if you like them and other people like them and trust them, I want my patients to go to them too. So if it fits their personality, go to this person. If you're going to jive well and get really good results, go to this person. So whether it's an osteopathic doctor, pain management, chiro, I'm not bashing on any of these guys at all. I highly respect them and want to collaborate. Acupuncturist, this I know the least amount of, but on average 75 to 150 bucks per session. I have had one acupuncture session myself, and I was like, oh, this is kind of cool. Physical therapists, we do trigger point dry needling, which is not the same whatsoever. I would never say I'm doing acupuncture, and an acupuncturist would never say they dry needle unless they're trained in it. So I don't know the Practice Act or anything if they're even able to do that, but that would be completely different. So it could be 60 minutes, it could be 30, it could be 90 minutes, I don't know, but session fees are about 75 to 150. This is news to me, but it's not surprising that there's limited coverage. I have seen on a few insurance plans, way at the bottom, that there might be a few sessions or whatever covered by acupuncture. So know your insurance benefits for your specific plan, and they might require a medical referral from your primary care physician or whatever doctor. So this is a great option for pain relief and stimulating the body's natural healing response. To my knowledge, it doesn't address the muscular or joint deficiencies that I talked with earlier at the massage therapist benefits and all that stuff. So we might be good at relieving the pain, but usually I haven't heard of acupuncturists saying, do this exercise. Maybe it's a stretch. We'll just say if the upper trap muscles are really tight and you have lots of tension, and they do some really cool techniques. They might scrape with the scrapey tool. They might do other things. They might say, do this stretch afterwards. That's fine. But assessing the joint mobility, motor control, specific strengths and weaknesses of the muscle, they probably don't do that. So what my program gives is more of empowering the clients to heal themselves. We have a Saldana Physical Therapy app, and this is like having me or Lindsay in your pocket. It's two-way messaging with us. It's more of like a long-term fix versus like a short-term relief of pain and then it comes back. No. We want to make sure we provide the highest caliber of care that we have through good communication, accountability. We want to make sure that we have the data to show you, in the past 30 days, you completed 3 out of your 30 exercises. Do you think you'll have a huge impact? Now, as if you've had 28 days completed out of 30, well, it's no wonder why your pain levels have dropped by 75%. Let's keep going. Let's get you back to pickleball, hiking, biking, exercising, going to your favorite group training class, or running a marathon. Let's do it. Whatever's important to you is important to me, and I want to get to know all of my patients as best I can with that high quality one-on-one care. I want to collaborate with your healthcare team and make sure we're on the same page. We do not want to just assume anything. So this is a crash course. Thanks for sticking with me. Sorry it took so long, 25 minutes, but understanding your options beyond insurance. What you only know is, what does my insurance cover? Now you have some more information of what you can do outside of your insurance. In particular, if you're not meeting your deductible, you could be saving a lot more going cash-based with a lot of these healthcare practitioners. So assess your risk for that. Make sure that you're not setting yourself up for failure, but this could be a very cost-effective option with magnitude more service that you get from the insurance system. So food for thought. If you have any questions at all, please throw them my way. This isn't negative whatsoever on anybody else. My main thing is throwing out information. And if you have questions about information, if I don't know it, I want to help you find the answer. For example, I don't do chiropractor adjustments. I don't do acupuncture. I could probably find you a good trusted one that I work with around here in the East Valley. Say, hey, call these guys. See if you like them. If you don't, I'll give you another number. See if you like them. See if you're interested. They do good work because of this, and that, or whatever. The more you know about your body, the better you can help yourself and the better that the practitioners can help you. Your symptoms are not whining. They're not complaining. They are information and objective measures that we can test before we start doing a treatment option. And then afterwards, and obviously afterwards, we want no pain, high function, decreased risk of falls or injuries, and getting back to what you love. So that's what's important to me. If you have any other questions, don't hesitate to ask. It's not bothering me. But thanks for sticking with me. Let me know, and I will talk to you later.